Good afternoon, ladies and gentlemen. Thank you all very much for coming once again to our weekly briefing, and for those of you who come to the daily briefing, thank you again. And thank you to the national viewing and listening public, both at home and abroad. Excuse me. Today, I want to continue from where I started last week, but would begin by extending the nation's sincerest thanks and appreciation to our public health staff all across the nation in our hospitals and all the support staff and caregivers in Trinidad and Tobago who have worked diligently, conscientiously to be able to put our country in the position that we are in today. I would like, before I continue, to ask the doctors or the doctor, Dr. Parasram, or CMO, to give us our daily update.
Thank you, Honorable Prime Minister, Honorable Ministers, members of the media, members of the viewing and listening public. Today's update, Saturday the 16th of May 2020, is as follows. Number of samples submitted to the Caribbean Public Health Agency and the UE site, 2,647. Number of unique patient tests completed thus far, 2,235. Number of repeat tests, 412. Number of samples which have tested positive remain at 116. Just to remind the population, our last positive case was dated the 26th of April 2020. The number of deaths remain at 8. Number of discharged persons, 107. So far we have one person left at the Cora Health Facility in stable condition. Just to add, in terms of our community sampling, we are now at 874 tests so far. All of them remain negative, and we continue our community sampling as the days progress. In terms of the update as it relates to the lab, so I had said a couple of weeks ago that we were beginning the process of quality assurance at a number of labs in Trinidad and Tobago in the private sector. So we continue that process. What we did is a number of phases in that process. So the first phase was a desktop review of reports that they would have submitted to my office. We would have originally gotten 5 submissions. Out of the 5 submissions, 3 of the persons suggested that they had continued interest in the process. They were visited by a team set out by the Ministry of Health. We compiled a document which was actually sent to the Caribbean Public Health Agency and PAHO. 3 of the labs are found to be in good order, satisfactory thus far. Out of those 3, we are preparing something called a PT panel, which is prepared by the Caribbean Public Health Agency. It's almost like a test, a physical test. So those panels are submitted to the private labs. They run them independently. They're double-blinded. Once you get the results are sent back to CAFA. CAFA actually looks at the results, analyzes it, and they give them a grade. Well, it's actually a test score out of 100%. So by the end of next week, we should have all those results returning to us, and we'll be in a position to say what the quality is at those labs after receiving the panels back. In terms of the regulation, I just want to reiterate, I know there was some speculation in the media. The regulation with regards to the lab speaks to the idea of reporting to the Office of the Chief Medical Officer of Health. Chief Medical Officer, it does not speak to the idea of operating. You can continue to operate, however, you must report any test results for COVID-19 to the Office of the CMO. If failure to do so can result in a fine of up to 50,000 as well as 6 months imprisonment. So, Prime Minister, that's my clinical update for today.
Thank you very much, CMO Dr. Parasram. Let me remind ourselves why we have been meeting here since January on virtually a daily basis, and why we have closed down our country, and why we have been asking people to stay home, and why we have been suffering the pain that we have been suffering, because many of our citizens, as it has been around the world, are suffering one way or the other. And it's because of the many hundreds of thousands of small microbes in the world, in the air, in the soil, in the whatever. There's one called the novel coronavirus, which is a very microscopic item, a little entity only can be seen by a microscope of RNA with a little bit of fat around it, and that's called a virus. That's why we ask you to wash your hands so that the soap will kill the fat around the microbe, around the deoxyribonucleic acid, and that will kill that microbe. Wash your hands to kill it. But it has traveled worldwide, from Asia to our country and elsewhere. What has been the effect of that? Just to remind the people of Trinidad and Tobago. Let's look at the region. Argentina, and I'm talking about deaths. Persons who were alive before December who are now no longer with us because of this microbe. Argentina, deaths, 353. Canada, 5,472. Chile, 358. Colombia, 525. Dominican Republic, 422. Ecuador, 2,338. Jamaica, 9. Mexico, 4,477. Puerto Rico, 117. The United States of America, 85,906. Venezuela, 10. Guyana, 10. Barbados, 7. Bahamas, 11. Trinidad and Tobago, 8. That's our western region. Approximately just over 100,000 people have died as a result of this virus, and the virus is still raging in our region. Looking at it globally, China, deaths, 4,637. You may recall the first report of this virus came out of China, and it is believed that it started getting its movement out of on science and testing. We say yes to that. Politics and impatience, we say no to that. Where we are now, where we've been all along, we've been saying that we will do nothing to tempt a relapse so that we could lose the gains that we have made. It is called a novel coronavirus because it is new. All of us in the world, governments, gatekeepers, whoever we are discovering what this microbe is and the effects it is having on people. As a matter of fact, there are concerns now that there may be some kind of effect on small children, which would require closer attention. But what we have done is to make decisions based on the science. I've led this government on that experience because, as I told you before, fortunately, I have had the opportunity to work on these kinds of issues. This is my 4th outing in civil defense, managing populations' interests in face of natural disaster. And at an earlier time, I functioned on the other side, not as a political decision maker, but as a scientist advising politicians to make decisions for exposed populations in civil defense. And on that basis, I find it very easy to rely on the professional advice to the politicians. And that is why we can say in Trinidad and Tobago, impatience and politics, no. Science and testing, yes. Last week, or before I go there, let me just share something with the national population. My sleeping habits have changed considerably since January. Usually I'm up all night following what's happening from Australia to the Caribbean every night. So sometimes I'm up until daybreak. because I want to know that the decisions we are making are not inventing any wheels or repeating anybody's mistakes. Let me just give you a little brief mention of what's been happening in China, where there has been an easing of restrictions. Notice the phrase, easing of restrictions. As a result of that, in those areas where there have been an easing of restrictions, the condition there is one of fears of a second wave. So restrictions being eased, but as you easing into opening up, there's an increasing fear of a second wave in China. In South Korea, which was deemed to be the country that handled this challenge the best, and had on May 6th, today is May 26th? 16th. 16th. So 10 days ago, South Korea began easing restrictions. Immediately, new cases are emerging. The restrictions were allowing a phased reopening of businesses. Immediately, they observed the highest number of infections in over a month. Public facilities such as libraries and parks have been reopened, and of course, immediately, the authorities had to order 2,000 bars and nightclubs to close again because clusters have emerged. And of course, in any reopening of the bars and nightclubs, South Korea has detailed 8,000 police officers to deploy for contract tracing of 11,000 known people. That is the kind of resource that South Korea have placed on this situation as they ease up. Singapore, which was viewed as again one of the better responses, getting good results. On May 12th, Singapore reported the commenced lifting of restrictions. Small businesses, barbershops, laundromats will be open. Once seen as a model for speed and efficiency in contact tracing, Singapore is now battling a potential increase in cases. And of course, we have a potential ballooning to over 26,000 cases. And of course, Germany had gone a little aggressively in opening, and their experience is now that cases are rapidly growing after restrictions were quickly loosened. So those are developed countries that got themselves, or think they got themselves to where we are in Trinidad and Tobago today. And I want to share with you Australia and Japan, because Japan was one of the early ones that loosened its restrictions. And Australia was in a better position than Japan, but they both loosened their restrictions. And I want to share with you the audio for those of you who are with us. These are authorities talking from Japan and Australia.
A picturesque region in the north that for now is eerily quiet. They're in lockdown here for a second time during this pandemic. A state of emergency declared again after they tried to return to normal too fast. Did they get it wrong?
I think that was a wrong decision, yes.
Professor Kazuto Suzuki is from Hokkaido University. After an early outbreak in this region, they quickly got on top of case numbers, limiting new infections to 1 or 2 a day, just like states in Australia. He believes when people there saw the decrease, they became complacent, wanting to get back to work and breathe life again into the local economy. Then, in 1 week, infections jumped nearly 1,000%. The decision, was it forced because people were just getting too they wanted their freedom back?
Yeah, they wanted to have a freedom back. There was a huge pressure on the society, economy, and industry. So we couldn't be able to continue the state of emergency much longer.
Your second wave is now worse than your first wave.
The second wave is bigger than the first wave, yes. So this has been a serious problem, and the second wave is definitely bigger than the first.
If you had your time again there, you'd definitely be doing things differently, I'd imagine.
Yes, I think we do. I think the most important thing is that we shall send the different message. The message of lifting the state of emergency was a wrong message, because it gives a sort of a sense of feeling that the threat is gone and everything is back in normal.
It's the same balancing act that our leaders need to manage as well. Australia's economy is being crippled, so there really is an urgency when it comes to easing off some of the restrictions. But get it wrong, and the fear is that we too could be savaged by a second wave of infections. Professor, are we through the worst of it?
No, I don't think we are.
Professor James McCaw is an epidemiologist at Melbourne University and warns we need to accept this is going to be a very slow burn.
To me, this is a little bit like a marathon. It feels like we're way into it, but we're only a kilometre in. So that first kilometre is hard. I hope the next 41 aren't so difficult, but they're still along. There's a lot of kilometres to go.
I think most Australians would feel like we've passed the halfway mark.
Yeah, look, and psychologically, that's a natural thing. I feel like that as well. But I also know from my profession and my experience studying how diseases spread and knowing enough about this virus, that we are at the start of that marathon.
One of Australia's biggest challenges in the coming months is actually the fact we've been so successful in limiting the spread of coronavirus. It means we have very little resistance to the disease in our population, which will significantly slow down how quickly we can reopen society. Can you give us a sense of the level of immunity you would need within the community for everyone to be safe to go out and resume life as normal, as opposed to the level of immunity we actually have now?
We're probably at somewhere around 1% immunity at the moment. To be able to prevent the disease from spreading or have it spread in a very slow and sporadic way, you're going to need upwards well over 50% of the population, possibly up to 70 or 80% of the population having immunity.
Impatience and complacency are two of the biggest dangers for Australia going forward, just like what happened in Japan. What's your message to Australians?
Don't take the lockdown for granted, and this is a very dangerous virus. You cannot relax. It is extremely dangerous because one day this asymptomatic person will infect others, and the power of transmission of this virus is extremely powerful.
Hello, I'm Tara Brown. Thanks for watching. To keep up with the latest...
So, ladies and gentlemen, what I did there was not paraphrase it for you, but give you the points of views of other authorities, public health authorities from Asia and Australia, so that you will understand that it is not only our epidemiologists and our doctors who are telling you what you should be doing now. Interestingly enough, that conversation from Australia is coming from the identical vantage point where we are now, in that we have done well, we have been successful in protecting the population from a huge infection of the virus. But something else you should note was that the expert there mentioned that as a result of that success, the population has very low immunity to the virus. And therefore, if the virus comes into that population during a reopening, that is fuel for the virus to propagate. And that is why in many instances, the second phase could be worse than the first. So what do we do here in Trinidad and Tobago? Balancing between the effects of the management of the viral threat and not forgetting what the reason is for doing what we have been doing. This last week in Trinidad and Tobago, I'm sure those of you who are following the national commentary, you would have got the impression that for some people, the paramountcy is no longer about saving lives. It is now about getting a business going, making money, or simply making livelihoods easier. If we move away from making the number one issue saving lives, then we could make grievous errors which will have a worse effect on the tribulations we're having now with the economy. Because if we do anything that results in us having to go back to the beginning and do the shutdowns again and the stay homes 100% and so on, we will hurt more economically. The thing to do is to continue to measure the risk, follow the science, make opening up decisions based on our understanding of the threat that could come, and also how much we have been successful. And that is why last Saturday I said to you that the doctors needed another 2 weeks to watch what the population produces for an indicator or indicators of what our national viral load is, and based on that we will determine what numbers of people should be out there and what levels of risk the government should be taking with the population and so on. And we indicated to you that we had constructed this 6-phase pathway. And last week, Saturday, we started phase 1, which was supposed to end on May 23rd, and phase 2 to begin on May 24th. But I did say to you then, especially those of you who are very excited that we should really get going with our economic activities, that if the numbers remain flat, yes, we will have the phases as the pathway, but we'll move the pathways forward. Today, I'm pleased to tell you that given the reports you've been getting for the last, today being the 8th day of that period, we needed another few days. But that was based on where we were last Saturday. Today, based on the advice that we've got and the analysis of the situation, we can make some further adjustments, some further tentative adjustments. So it is my intention today to advise, and the Attorney General and his office and the Ministry of National Security and the Ministry of Health will operationalize these instructions. We will move phase 2 to kick in a little earlier than May 24th. So the 14th day of the period that was requested will end on Wednesday. Huh? And that will give us the cover for the incubation period and satisfy the public health requirement to observe that incubation period to see whether there were any increased presentations of the effects of the virus. Thankfully, that increase has not occurred, and we can now look to Wednesday. And therefore, I can say to you today that phase 2 should begin on Thursday. Thursday being the, what date is that? What's Thursday's date? 21st? Well, Thursday, today is Saturday, well, Thursday we're going into phase 2. And what phase 2 means is that whereas phase 1 was the opening of restaurants and non-itinerant businesses and so on, and members of the public who were allowed outside to begin to exercise, and those are the phase 1 things. We extended hardware. So for phase 2, we are prepared at this time, again, bearing in mind that there will be conditions attached to how we behave. And those personal behavioral conditions, the CMO and his staff will come back to it after I speak to you. We will reopen the manufacturing sector. The entire manufacturing sector will be open from Thursday. And of course, we'll go further and we'll open the construction sector across the board. But because we are doing that, we expect that more people will be on the move, going to work and coming from work. So because we know that that condition of people being close in public transport and in private transport will be increased, and because we want to preserve our position of denying as far as we are able to that fuel to the virus, we will want transportation conditions to remain. So maxi taxis and public transport will still be required during phase 2 to do that spacing that we are asking for, and we will enforce it. We will ask the police to enforce it more than ever because we have more people outside more than ever. So it is more than ever important now for that spacing to take place. And because we are doing that, particularly to the maxi taxi operators and other taxi operators, mainly the maxi taxi operators, the Minister of Finance will make available to all maxi owners, maxis are owner-operated or owner, whatever it is, but each maxi, the Minister of Finance will make a fuel support grant of $1,000 available immediately to support the public transportation efforts of these $2,000, not one, two, $2,000. We'll make a fuel support grant of $2,000 for the maxi operators to be able to conduct their business and transport our people who are needing to go to work and coming home from work, so we have transportation to carry that 50%. So we are maintaining the 50% usage of the equipment. And of course, we are saying to the population, if you don't have to go to work, if you don't have a job to go to, if you just want to leave home to go somewhere, please don't. Help us to let phase 1 be brought in earlier, and by opening phase 1 on Thursday, it will not hurt the approach. Phase 2, sorry. It will not hurt the approach if you use Thursday into Friday in preparatory work and kickstart fully on Monday. Because what we're trying to do is to get activity at minimum numbers for the time being. So we're clearing the activity to commence, but we want you not to overpopulate it unnecessarily. But of course, we want people to go back to jobs as early as possible. This would be a big number of people that we are bringing out. Last time we brought out the restaurant workers, those who go to restaurants, those who supply restaurants and so on. Well, they're still out there. We're now adding another population. So we are carefully adding another group of people. But for that to be successful, or to give us a better chance to be successful, we are asking the rest of the population to stay at home if you are not required in these sections. And that means if we get a good result in phase 2, we can then bring phase 3 forward earlier than this plan. So we are working the phasing system. I would want to stop here for the moment and ask the technical people to give us their perspective of this and to speak to the population directly from their vantage point. But I simply want to say one thing, to Trinidad and Tobago. You see self-interest? The biggest danger in managing this kind of situation is self-interest. I'll give you one example. There was a major volcano in western United States a few years ago. The scientists were telling the government that the volcano had become dangerous and had become too dangerous to be populated. The government took the advice of the scientists and forced an evacuation from that volcano. Most people complied and had to leave their home at short notice. And they went out. And after a few days, nothing happened. The volcano kept indicating that an eruption appeared to be imminent. And in the eyes of the scientists, it was virtually a given that the volcano was going to erupt. But people were away from home, and being away from home is uncomfortable, They left at short notice, so they had all kinds of things they wanted to have were still back in there. And in the event that the volcano did erupt, they were going to destroy their homes and destroy all these lovable things. And political pressure was brought to bear on the local state officials, to the point where, as you know, and under those circumstances, everybody suddenly became a scientist. And they had more information and they knew more than the scientists. And the political pressure was brought to bear on the local authorities. And the local authorities caved in and arranged for the population to go back home, at least to pick up their valuables and to spend some psychological time in their homes and then come back out if things change. That was the decision that was taken. And the morning when those people were assembled in a huge car park to go back to that volcano, in a convoy, that very morning, they were able to watch their lives pass in front of them. They viewed the eruption from the car park as they were assembling to go back home. That happened in the United States at Mount St. Helens. And of course, we had other examples here in the Caribbean. So I tell you this so that you would place your personal response to what the government is doing, to the understanding of the basis on which we are doing this. And the biggest danger we face right now is to subsume national interests with self-interest. And to listen carefully to the voices who will tell you that I am safe because my family and I would be in a safe place because we put them in a safe place. Look at who have been dying around the world in response to this virus. Dying largely because of how they live, where they live, and how they cannot withdraw. They're the ones who are dying. And that's a distinction that you have to make. We, as the government of Trinidad and Tobago, we make decisions in the interest of all the people of Trinidad and Tobago. And none of this has an iota of self-interest. Could the medical team take the opportunity to justify what decisions I have made here today?
So the general principles relied upon in terms of public health decisions when we look at reopening different sectors is, of course, we're looking at businesses that have an established quality control and OSH environment that they can operate into. For instance, with the restaurants, we would have had many years of, through the public health inspectorate, looking at the restaurants and licensing both the restaurants as well as the persons working in the restaurants, the employees, by way of food badges. So there's a dearth of information from a public health perspective as how they should operate. There are protocols that are in place. Similarly for the construction industry and the manufacturing sector. We have put out our guidelines as well for workplaces, an official guideline from the Ministry of Health, which will be shared, already been shared to most of the stakeholders. But we're looking at establishments that have the ability to mitigate against the public health risk in the first instance. And as we go from phase 1 to phase 6, you find that the mitigation levels and the things that we can put in place becomes less. For example, as we go further down, we look at things like congregation, where people may be liable to congregate. There's close contact. Those things are very difficult to mitigate against. There isn't, outside of the regulation that speaks to 5 persons congregating, in terms of social distancing, there aren't regulations that we can use to mitigate the risk. So as we go from one phase to the next, we look at, and we keep adding areas of interest that will have less and less mitigation potential. And that's how we choose our sectors. I would like Dr. Hines to follow me, and then Dr. Trotman. Dr. Hines is going to speak more about the potential of spread. So as we reopen, we have no cases for the last 21 days, which is basically almost 1.5 cycles. So it's 1.5 cycles we have gone through. We haven't seen an additional case. I normally get a call whenever we have a positive, and has been that way since our first positive for this epidemic on March 12th. I get a call directly from the lab if we get a positive. I look at my phone all the time, And I wonder if we're going to get a positive and where is it going to come from. And that trepidation continues, and it will increase more so as we continue to open the economy. Dr. Hines is going to speak about the potential of one. So the potential of one person to become a super spreader, and I'll ask Dr. Trotman to follow more right after to discuss the enhanced social measures and public health personal protective measures that we expect to take once we have an increased movement to protect the society. So Dr. Hines.
Thank you, Dr. Parasram, honorable ministers, members of the media, the viewing and listening public. As Dr. Parasram has said, one of the main concerns is that although we haven't seen any confirmed cases, any persons who have been tested and have been found to be positive, we do not delude ourselves to believe that there is no possibility of any case anywhere in the population. The measures that have been in place to prevent persons from coming into contact with one another are the measures that we are now actually rolling back. Those measures have been protecting the population from the potential of spread between unknown cases. As we roll those measures back, there is the possibility that anyone that has mild illness that's wandering around the population can then wander into a crowded space, wander into a small business place without good ventilation, could wander into a place where lines of persons have lined up less than 6 feet apart. Those concerns are the concerns that keep us up at night and the things that keep us very vigilant in the testing that we're doing. We are at the point where we are actually encouraging persons with any kind of viral illness to come to the various health facilities for testing so that we don't miss new cases. And it keeps both Dr. Parasram and myself up as we keep looking out for new cases that may pop up, because a new case means a whole new exercise of tracing, isolation, quarantine, etc. And as we increase the ability of people to interact, and the ability and the tendency of them to congregate, we do have the risk of what we call super spreaders, someone that goes into a place where there isn't enough social distancing, there isn't enough barrier protection, which Dr. Trotman will speak about in a little more detail. And those persons can infect several people around them, who can then go on to infect additional persons in large numbers. So in a very short space of time, in a couple of weeks, you go from one case to 16 to 256 ongoing on the basis of not being aware of that congregating effect. The issue of having persons move between households, as some of the domestic cleaning and the household care staff might want to do, is another area where the risk of either picking up or carrying the infection from one household to another is still very real. And for those sorts of reasons, even if you are well, you may go from a household where everyone looks well, but there's an asymptomatic person. You pick up virus, you go to another household with an elderly person, you spread it. You go to heaven forbid, you go to a house or a home that actually takes care of elderly people, and you deposit droplets there. These are the things that we're still trying to mitigate against in very large measure. These are the factors that really govern the speed with which we do the rollback, as we try to establish with greater certainty the fact that there aren't still circulating cases that are asymptomatic. So I do want to conclude there and turn over to Dr. Trotman.
Thank you, Dr. Hines. We have Dr. Trotman now.
Honorable Prime Minister, ministers, members of the media, members of the viewing public, and I must certainly address members of the healthcare staff. I first want to extend my thanks to them. I'll take off my mask. I'll do so slowly, because this small piece of clothing is one of the biggest defenses that we have. I'm going to come back to it. I want to thank the members of the healthcare staff and the healthcare population and all the supporting staff that go with them. And I want to hope and pray that as we move forward, there will be less for them to do. And the way for that to happen is for as we allow movement, which is the way for corona to spread, as we allow movement, that we not only understand, but we practice what we have to do. 3 simple things. As we roll back and we allow movement, that we practice what we all have to do. Not myself, not the ministers, everybody. And we have to take it as an onus when our neighbor isn't doing it, to love thy neighbor and say, do it. The 3 things that we have to do. We all can't move at the same time. But we are allowing movement, and we are allowing more and more movement. But we must continue to do 3 things. Sanitize. That means, in the first instance, wash your hands for at least 20 seconds. And most places have signage that describes how you wash your hands. You wet them, you apply the soap to your hands, you interlock your fingers, you wash in between your fingers, you wash the dorsum of the hands, you wash the palms of the hands, you wash your thumbs, you rinse your hands. You dry your hands if you can thoroughly with a single-use towel and throw that away. That's a lot, huh? It's a lot. And I may have forgotten 1 or 2 steps. But you get the gist. Wash your hands. Because, as I told you once before, that's how that virus gets into us. One big way is when it gets on there with the hooks. Hooks onto your hands, hooks onto your face and mouth, and gets into open orifices. Sanitize if you can't by washing your hands, then with sanitizer that is being provided most places that you go. That's one of the 3 things. As we move more, that we sanitize. Sanitize on our own, sanitize in areas where it is provided for us. Don't walk past the sanitizer. And if you see someone doesn't have it, or a business where you are going doesn't have it, then say, you know what, I'm at risk. I'm going to point that out to someone. Because we all need to sanitize. This is everybody. This is not just us. It is everyone. Sanitize. The other second thing is we have to distance. We have to move away, we say at least 6 feet, so the virus can't get from one person to the other. And sometimes we can't, but in as much as we can, we do that. So you go to the grocery and somebody is reaching for a can of vegetables. Allow them the space. Because we may have let in 5, 15 people, but you could still not distance because you physically, personally do not distance. Simple. Try our best to maintain that distance of at least 6 feet while respecting and loving thy neighbor. And the third thing, wear a mask. You don't have a mask? Think about all the carnival parties and the bandanas we jump and wave. Let's wave corona away. Put on the mask. I get excited because I color coordinate. And a lot of people are doing that. If you can't color coordinate, if you don't have a mask in the ultimate area, use your jersey. cover your face and your mouth. And try your best not to touch, and I know it's hard because I do it a lot, is to adjust that mask and because of course we know that could also cause a bit of spread. But you know the idea. 3 things. Sanitize. Stay apart. Wear a mask. I want to conclude by thanking the population for doing those 3 things. I thank the healthcare workers in the first instance. And you like me, I'm running out of clothes and I need this and I need my nails done and we need all these things done. But while we're going through all of that and while we are being allowed to get some of that done, let's say thank you to our Honorable Prime Minister, the rest of our staff and the healthcare staff that have put us in this position that we could continue. We want you to allow us to continue. 3 things. Sanitize, separate, and wear a mask. Thank you very much.
Thank you. Thank you, Dr. Chotman, for that reminder. So let me get back to what's permitted going forward. We will add to activities that are permitted. Motor mechanics and tire shops opened up for servicing. Laundry and dry cleaning opened up. But of course, those business places will have to follow the protocols of spacing and other directions that will come to you in what we've been asked to do before. The Attorney General will make the adjustments in the regulations, and the police service and the CMO office, where additional persons would be made available to the CMO's office, the district medical officers, who are the people under the Public Health Act who will come out and look at what is happening. And if they find that there are circumstances which do not meet the requirements of the legislation, there will be firmer law enforcement. And let me just remind the population that there would be no law breaking on the part of the police and the CMO staff, but there's considerable legislation in existence to allow them to direct public health issues. If there are other advice available, then my advice to you as a member of the population is to take the advice that you're getting from this forum, that there is authority to encourage you to cooperate, if not only for your own protection, but for the protection of those who require the protection of the state. We would, I mentioned the tire shops. I mentioned that. Yeah, so the area of greatest difficulty for us today, we would love to have been able to open up a bit more so that personal services, meaning barbers and hairdressers and domestic workers, to go to work, because these are people, many of them at the lower end of the earning scale, who are hurting. We know you're hurting, but the circumstances are such that your area is the area that poses the greatest threat. You heard Dr. Parasam spoke about some people who go from house to house. If one person is carrying that virus and they move from community A to community B to work inside the home, the risk to the family in the home and other families, and some people work for more than one family. That is the kind of environment where the risk is greatest. So we're asking you, even though we understand what you're going through, we can't fix it by easing up for you, because that has the potential to capsize the whole thing. But what we're going to do is to ask the Social Services Ministry. I will direct the Social Services Ministry to ensure that the assistance that is available to persons in this category, which is individual small business, persons in the category of domestic worker, persons in the personal services area to allow them some priority in the access of state support for basics. That is the best we can do at this time, and we're going to try to do that. And of course, it's only for a short time once our numbers remain the way they're going. But the minute we get to a point to make a decision to lift it, I give you the assurance that we will. Now, you will see a new kind of patrol. You know, you have the patrol of police and soldiers. That's been going on for the longest while. You will now, in this phase going forward, you will see a patrol of police and district medical officer. And the reason for that is this. You will be encouraged to cooperate. In the event that you don't cooperate, and there isn't the authority for the police to act under the regular or the regulations that govern police action, there most certainly will be the opportunity for the district medical officer to act under the Public Health Act. So between the police and the public health officer, there is enough legislative authority to make you comply. And I'm simply saying to the population, in Trinidad and Tobago, we have a phrase here, something called powerful stupid. Please do not participate in that. If the police ask you to do something, don't say you don't have the authority to tell me that, because the medical officer has that authority. Because if what you are doing, whether it's a congregation or the condition under which you're selling food, if what you're doing offends the Public Health Act, the district medical officer has a lot of power to act. So I give you that as free fireside advice. Now, the mask. We would like to move into a phase, very simple. No mask, no service. Covering, if not everything, the vast majority of things. No mask, no service. That's an encouragement. And I'll tell you why. If you go into a business place and offend the Public Health Act, the other act requires that the operator of that business must conduct his or her business in such a way that that business operation does not offend the public health. So if that operator says to you, no mask, no roti, no mask, don't come in here, it means that they have an authority to tell you that. And all I'm asking you to do, let that be your contribution in this war against this virus. That is not too much to ask. Because you see, in the beginning, I said to you that this virus is going to call for sacrifice on the part of all of us if we are going to be successful. As a nation, we've done wonderfully well so far. I also said to you that the burden is real, but it will have to be shared. I am not naive. I know that there are persons who see opportunity to prosper. Nothing wrong with that, as long as self-interest does not prevail over the public interest. The burden has to be shared. And as we make decisions, whether it is from this forum, in these decisions, or as we go to crafting the roadmap going forward for the nation, the burden will have to be shared. And it's being shared by the vagrant in the street. I hope we've taken them off the street. We've made some efforts to get them off the street, because the generosity that is on the pavement may not be there. We have to go somewhere else to be looked after by the traveling public. To the small business owner who has run out of money, to the corporation that is looking askance as to whether they should dip into their, what do you call it, fund, where they put aside money. So all of us, every one of us, is required to make a sacrifice. But we can reduce that sacrifice along the way, and where the sacrifice is inevitable, as with those persons I just mentioned, we need to extend some improved actions of care. And of course, as we communicate with you on a daily basis, given the numbers we have been having, and wanting to give some relief to the staff that has been working 20 hours or more per day, we would report to you now, not on a daily basis, but a little less frequently. We laid a schedule out of Monday, Wednesday, Saturday. And we'll come to you immediately if the circumstances changes and warrants your immediate notification. So no news would be good news, and we will undertake to report on Monday, on Wednesday, and on Saturday going forward. Question time. If you have any questions, we'll take them now.
$2,000 for the MAXI taxi. Is that a one-off?
Yes, it's a one-off. It's to assist with fuel. It's a one-off payment for the period, covering the period now until June, when and we hope that sometime well before that, well before the end of the month, we could be able to tell them to go back to normal. This is for yeah. We will tell them very soon that they could operate with a 75% capacity and then 100%. And so this is going to be for a relatively short period of time.
And what kind of cost have you all set aside? Do you have an idea of
the cost of this? This could be costing us $6 million. It's approximately $6 million.
And I would assume that it would also include registered taxis as well.
Registered taxis, yes.
Correct, because we have a large segment of our population that are PH drivers that are now charging persons double. We do have those concerns coming out.
I will have a public servant will have difficulty paying somebody who calls himself a PH driver. That is not covered by the, but there are other avenues for access and support there. But in terms of this particular payment to public transportation and registered taxi owners,
how will the MAXI and taxi drivers access this money, and what, if anything,
the Ministry of Finance? The Ministry of Finance and the Ministry of Transport had finalized that. We anticipate that it will be done by the Ministry of Transport.
For taxi drivers and MAXI drivers themselves who would have applied for other social relief measures, perhaps like a food card.
No, this does not affect other social measures. This is specifically targeting the loss that they are facing for the additional fuel that they have to use, not recovering that expenditure by virtue of being ordered not to carry passengers. And that not to carry passengers is for the benefit of the public. So the public is making that contribution to the MAXI interest.
The $6 million was part of the $6 billion that the finance minister
It's an approximate figure, so if it turns out to be a little less or a little more, that's the approximation that we calculated.
Was it part of the $6 billion budget that the finance minister spoke about? Or
I could say yes, because 6 million and 6 billion, money is fungible, right? We don't have to identify the particular dollar bill.
The manufacturing sector that you report would include like the car assembly business in Trinidad?
We have a car assembly business here?
There's several
car parts?
Yeah, car parts.
But basically, we need to service the transportation sector, and we say it's motor mechanic service, tire shops, and parts places, and so on.
Not dealerships and
No, we're not going to. At this time, phase 2, not dealerships.
And this as well would be sticking in the same vein, opening on Thursday, not immediately.
Thursday is the day when we are lifting the phase 1 restrictions and allow these things to begin. So if you begin to do it before Thursday, you will not be covered. If you do it from Thursday onwards, you will be covered.
So you mentioned the
but we expect a certain amount of consumption of a little of that time in preparation. So if you prepare, some persons may not work on the weekend, some may, and going forward.
car sales.
No, we are not. For the moment, we are not into dealerships for car sales.
So you you mentioned the interest, self-interest, some persons superseding national interest. And there are certain segments of society that have been clamoring for reopening.
I'm not going to go further in that conversation. I'm sure, I'm sure you understand what I'm talking about, and it's not just those, it's general. I'm speaking generally. If in your self-interest you believe that you're strong enough and you're healthy enough and the virus can't do you anything, that is a kind of self-interest too. So it's all self-interest. What I'm asking for is an understanding that we cannot make decisions based on the interests of only a person or a segment. The decisions have to take into account the wider national community's interests.
I just want to clarify with the construction opening, all construction, private and public. And
construction.
And mining as well?
Construction issues. That's a good question, because, we did have an application, before I made this announcement, we had an application from the T&T'S in Tobago for an exemption to open their quarry. So today, they don't need that exemption anymore, because we have said that you could continue. And we are doing this because that's largely outdoor. The spatial conditions will be met, and all we're asking for those persons is what Dr. Trotman said. That's why she was so forceful. Now that we are going out there, it is no longer trying to beg you to stay home if you're working in the quarry. It's while you're at the quarry, wash your hand. Wherever you are, wash your hands. That is your part now, because you're coming out. Right? So it's a build-up and a relief at the same time.
Calculate that figure, that $6 million figure. Was that based on documents currently before?
We have a rough, we know approximately how many MAXIs we have and how many taxis, an approximation. And if you have a figure, you multiply the number by the figure and you get a figure. But again, as I want to say, it's an approximation. A budget is an estimate. Right? So don't let it get too much of your valuable time. And we'll report, as we've been doing, as to what it actually turned out to be. So we have an approximation. We budget $6 million for that.
Question for the Health Minister,
Sure.
Wilson from DTT. No mask, no service. So how was the initiative regarding the distribution of masks and feelers that completed?
Yes, so the distribution of masks via field is going on very well. The last count I had, which is quite old now, is probably about 2 or 3 weeks, is that they have done about 30 or 40,000 masks, and they continue to do masks throughout field. However, you can make your own mask at home. Simply take an old T-shirt, you can cut it, and you can get 4, as I have done. You can get 4 or 5 masks out of an old T-shirt. So there is no excuse, Dr. Trotman, correct? There is no excuse that anybody should not have an mask. I'm sure everybody has an old T-shirt at home.
And let's put it this way. If you find yourself, for any reason, without a mask, I'm sure there's a bandana available to you. And assume that dust is blowing. You don't need the government to tell you it's dusty, how to put a bandana around your face. At least try that. Within 24 hours of the first instruction that you have to have a mask, I was pleasantly impressed when I went back home. There was one on my bed, because my wife made one. She made 3 or 4 from a T-shirt. So I had a mask before anybody else could give me one. So don't let not that be a big problem if you really want to cooperate. And especially for children, parents, please, if you're taking children out, do look after their interests and make sure that they're properly covered.
Go ahead.
How many district medical officers do we have?
They report to the CMO, so let the CMO on.
So we're talking about levels, right? So there are county medical officers of health. There's 1 per county, every county in Trinidad, which is 8. There's 1 in Tobago. Under those individuals, there are district medical officers of health, and there are public health inspectors. Generally, on average, there's anywhere between 10 or 12 public health inspectors to our CMOH office. So let us look somewhere around 100, thereabouts, in terms of total number of people. But we also collaborate with local government. Especially in the cities and boroughs, they have overarching control. So their public health inspectorate work hand in hand with our public health inspectorate, and they take the number up considerably in terms of number of people on the ground.
And if I can make a supplement this, we had this discussion before coming here. I'll be going to the permanent secretary on Monday to take on some extra persons on contract, have them suitably trained, and work alongside their superiors so we could have more bodies on the ground. And as the Prime Minister indicated, we will also be partnering with the T&T'S. So we are going to have many more bodies on the ground looking at the enforceability of the public health regulations and laws. Okay?
These bodies that we're going to be adding already in the healthcare system?
No, sir. I'm going to the PS on Monday to take on extra people. Okay?
But they don't have to be trained, or?
No, I think I indicated they will be trained. They will be given a crash course in public health and work alongside an experienced person so we could put some more bodies on the ground. Not only for bodies' sake, but for implementation of the public health measures.
No.
They just need additional.
So basically it is an augmentation of what is happening, and the simple measures based on our guidelines that we expect to be put in place into the workplace. For instance, if you have a supermarket, we would expect that social distancing is occurring and there's amenities within to do that. There's hand washing areas, there's sanitizers, those kinds of things. So it is almost akin to a monitor, which we have for CEDA program. So they'll be monitoring how the progress goes in terms of making those guidelines, protocols, and how the enforcement is going on the ground.
Staying with that though,
Yeah.
because the manufacturing and construction sectors are two large sectors that will bring out a lot of persons. And the onus would now be on the employer to ensure that there are sanitization taking place, hand washing facilities available. But for employers who are found to be in breacher, or for employees who know that their employers are not they're not complying with regulations. Right. What sort of protection is there for these employees who would like to make a report or would like to indicate to the authorities?
So of course you report it to the Ministry of Health through either the head office or the Public Health Inspectorate. So that's your line of reporting, or any of the CMOH offices throughout the country.
How long will this training be for? And
well, generally speaking, it's a very simple sort of training because it is a monitoring function. So really and truly, you just need to be able to go out and say whether X supermarket has hand washing facilities, has enough spatial arrangements. For instance, if you're looking at manufacturing, you're looking at the distance between the cubicles, that sort of thing. So it is a simple sort of training, but really it is a monitoring and evaluation function.
Have you worked out the possible remuneration for these?
No, we just took that decision. I'm going to the PS on Monday. But may I also add, we have also completed a document which I signed off on Friday that talks to safe work practices, that gives guidelines for all industries, manufacturing, retail, distribution. They are general guidelines, and then each industry will now have to have their separate protocols. Dr. Rahman would have spoken to some of these issues yesterday. So that general guideline I would have signed off on Friday, and that will go out to all the business places and industry heads.
How many people are we looking to add to the public health?
Okay, so I am going to the PS on Monday. We just took a strategic decision today. We will work out all the details next week from Monday.
You've indicated now we've been 21 days free without any positive cases being reported. What is an acceptable level of spread or that virus surfacing? Again,
well, I don't think there's any acceptable level of spread. We want to keep it as we have seen, it has been 0 for 21 days. We hope that it stays that way. But as Dr. Hines indicated, it takes only one person to generate quite a substantial amount of persons being infected from that person. So if there's one person out there that has mild symptoms, has not presented to the system, they go out, maybe belonging to one of these sectors, the manufacturing sector, you go and work in an environment where there's 100 persons in that environment, you go to work sick. And that's why we have said at the outset, part of the new normal is to stay home if you're sick. Is one of the important 6 or 7 rules we have in the new normal, which has been circulating out in the media. That last one, stay at home if you're sick, is one of the most important ones. Because if you're ill and you go into an environment where you have hundreds of people, as we have seen in other countries in the Caribbean and the world, we have seen it happen in Jamaica, we have seen it happen in Barbados, other countries of the world around us, and further afar, that one person has led to thousands of cases, and then the cascade follows.
Let me just give the national community an example that we could all learn from. And you could there's something called Typhoid Mary. Everybody should have heard about Typhoid Mary. Mary was someone who lived in New York in the 18s, whatever. She had typhoid, but she was asymptomatic. And every family she worked for, 4 or 5 people would die. But she would move from family to family, so she was the original super spreader. And that is why, as Dr. Hines says, you don't want domestic people now who work in 3 or 4 families. You know, that is a very great risk. So let's learn from Typhoid Mary, who was asymptomatic, but just left a trail of death as she moved from house to house in upscale New York.
Well, before the minister gets any more macabre, let me just get back to where we are. Typhoid Mary was a primary school example for us when we didn't have WCs. We are now, in the context of what the minister just mentioned and the CMO, our closed border is now as important now as it was when we closed it. Because if we are to preserve and strengthen the condition within the country, the biggest risk, other than a Typhoid Mary walking around, is person coming from the outside and bringing to us the virus. And worse yet, getting into the national community and causing it to be spread unknown. So we need now to preserve these conditions in this country for as long as we could. While the virus is an international threat, we preserve it, and the borders will remain closed except for our managed introduction of persons from the outside, and that includes our students from our campuses. We've taken steps we're working with the government of Barbados and the government of Jamaica to move the students up and down the Caribbean. You would have heard about that before. We did give our students some help on the campus, but now we are aiming to move. It's not a simple operation because as we sought to fix the time as early as possible, then the students are telling us, or the principals are telling us, well, exams finishing on this campus on that date, and exams finishing on that date, and we're now looking at exams finishing in Mona in July, first week of July. So we have to make a decision somewhere along the line where some people might be left behind for the moment, or because the students really want to complete their assignment as well as come home. They have 2 requirements: finish their exams and come home. But we're working with the principals in the campuses, and we are, contrary to what you probably would have heard, that we've abandoned no one. We've abandoned no one. And, you know, let me just say something, because a lot of decision is made in this country without the requisite information, and sometimes information will help to clarify things. I saw Mr. Chin being publicly pilloried and the minister being pilloried because there are people in this country who only see the dull side of the coin. And of course, it's easy to accuse the minister of playing favorites, and of course, it is easy to accuse Mr. Chin of throwing his weight around. Let me tell you exactly what happened. Because as Prime Minister of this country, I find myself involved in a number of things and responsible for a lot of things. In our context of applying for exemptions, a lot of people applied for exemptions. And the government's approach was that we will manage introduction of personnel into the population. That application from Mr. Chin, through his lawyer and through himself, was there for a long time. And he was denied permission to come, because the policy is not who could pay a plane, fly in. It's that nobody is coming in unless there's extraordinarily good reason for that, because we want to preserve what we have been talking about here all afternoon. And that application was before the minister, and it was being made and remade and made and remade. In the meantime, another application came in from a citizen who had found herself in difficulty in the Bahamas, and the minister immediately granted an exemption to that person. But then the person reported that if I have the exemption, I've been trying. There's no way I can come home because there's no mechanism to get me home. So the exemption that was granted to that person could not be utilized. And the government took the decision that we told Mr. Chin, if you will agree to pass in the Bahamas on the way home and bring that lady home, you will get an exemption. And that was agreed to, and that is what happened. We thank Mr. Chin for doing that, and we wish the lady the best. That is what happened. So there's no need to attack Mr. Chin for throwing his weight around, and there's no need to accuse the minister of playing favorites. It was a situation, and the decision was made at the appropriate level, and I'm sure that from a humanitarian standpoint, all's well that ends very well. We remain in lockdown. If you are not required to be out, you are required to be in. If you are not required to be out, you are required to be in. You have the opportunity to go out for exercising in a restrained way, focusing on the protocols. Stay away from people, and of course, cover your face. And expect that you have to have a mask if you are going to have any service. Cooperate with the national effort. And I want finally to thank the national population of Trinidad and Tobago for cooperating with the government of Trinidad and Tobago, a government that placed its confidence in the people of Trinidad and Tobago from the beginning. We felt that it was possible to talk to you, get your agreement, get your cooperation, and we will do it differently. We've done it differently, and some people are saying today, we've done it the best. I thank you for your cooperation. More questions?
Another exemption that has created a lot of controversy was the exemption given to the Venezuelan vice
I'm not,
president.
you see that? Today, I am not wasting any of my time on that. Today, I'm talking to the people of Trinidad and Tobago about their lives and their livelihood, and those fabricated scandals is for another time. You know, when I come to this podium, I spend hours talking to you. Today, I'm not raising that. Not because we're afraid of it, but because I just don't want the population to be confused with foolishness. We spend enough time on that. Yeah, the population in the hands of those who would mislead them. We'll come back to it at another time, I give you the guarantee. But today, I am not coming off this subject of phase 2 and the lives and livelihood of the people of Trinidad and Tobago. Those who fuel in that, every time we engage it, they succeed. Not on my watch today. Thank you.
I know that we're going back to that 21 days free, COVID-free, but what would be the length of time, what would be an acceptable length of time to say that we are in fact COVID-free? And secondly, how much community testing do we need to complete before we actually say that yes,
we will continue community testing for COVID for a long time from now. It will become part of the way we do our respiratory panels. As the number of people begin to move, we expect the number of viral illnesses other than COVID to continue to increase. We will test those people as community samples as long as we have to. So that will form an increased number in terms of our respiratory panel. The numbers are dependent on the number of virus illnesses that we have. We want to be able to test a sufficient proportion of the people that come out that will give us the certainty that we're not dealing with COVID-19.
We had the bars and cinemas and stuff like that, those were in different phases.
I thought you were finished.
And
last question.
Just because, I know, well, we've now moved up earlier because we've seen good figures in phase 1, we moved up phase 2. And of course, similarly, phase 3 could be moved up if we continue that way.
Bars remain closed.
So, okay, so
bars
there is...
For a little while longer.
Bars and cinemas, because, I mean, as we go on...
Remember I said politics and impatience are the threats that we face, right? Let's be a little more patient, and hopefully, in the very near future, we should be able to open the bars. Let us work towards keeping the curve, no curve, not curve, keep the line flat, right? So we are talking about keeping the line flat, because we don't have a curve. Thank you all very much, and thanks for cooperating with us.